All right, YouTubers, we are with Dr. Sam again. Video 1 intro, who, what, when, where, why. Dr. Sam, tell me a little bit about you.
I'm Dr. Samuel Evans. I am a Arkansas U.S. physician. Have been for many years and still are. At the last 14 years, I've been in the Republic of the Philippines, in the southern Philippines, in Mindanao, where much of the unrest has been in that nation. I went there to work into remote places, so I do a lot of work with the rebels and the other groups there. The Philippines has an interesting culture, and that is quite different and much more acceptable and courteous toward particularly the elderly than we have become here in the United States. The work that we do in the Philippines has to do primarily with training healthcare people and teaching community health in remote places. When I say remote, I'm talking about places that are 3 to 6 hours by motorcycle or hiking from the closest physician. Not just a hospital, but physician. There will not be nurses or other medical consultation type of people available to these people.
How many people have you seen in the last 10 years?
We've seen over 107,000 patients since 2006. Reach International was formed. Myself and my wife are the co-founders of that. And we've had some 5,000 surgeries in that same period of time. We've worked in a number of disasters during that time, hurricane relief work, and we do also first aid training classes. We do all this with a small team of from 4 to 5 nurses on the team, myself and my wife, with one married couple on the team who help with the administration side. The questions I get asked is, why do you go to the Philippines? The Philippines was because I went there after I had been trained here in the United States. I worked in the state of Arkansas for 10 years. I was over the outreaches for the Masters of Nursing program in the state of Arkansas, which was the nurse practitioner program. They worked with me in my nursing home practice and trained with me. I taught in their nursing school, as well as with medical students, as well as office assistants. And so most of my life, even as a physician and having a private practice and working in emergency rooms, was also as a teacher. And so I thought, in year 2000, I went to the Philippines and we saw some 4,000 patients in less than 3.5 days. I'm the only physician, 2 nurses, a pharmacist, and some Philippine pastors, along with non-medical people who was able to see these patients. But there was 2,000 unseen at that time, and so we triaged the really sick ones out of that. And yet all the stories you hear about, some of them traveled 2 or 3 days to get to this remote, isolated, off the road. I mean, we're not even on the highway. We're not even on a dirt road. We're off the highway in a remote, very small village, some 4,000 feet in elevation. And here we were doing surgeries and seeing patients. So this concern about the remote area, how far they had to walk, how long it took them to get there, how difficult it was to get to a physician, both from a financial viewpoint as well as from just access from the remoteness of their ability to access physicians, wanted me to go there and teach and train resource people in communities who can triage people, determine what is dangerous versus not dangerous, help people make wise decisions when to go to the hospital or when can they try doing things at home, if you will, home remedies, to try to take care of their own health and have some idea of when that may turn dangerous and they would have to go to the hospital. This has been after our training starts and we've been in an area for 6 or 8 months, For every 4 going to the hospital, there will only be 1 going to the hospital. So it really decreases the amount of people having to travel out, and therefore the community has more resources for those who have dangerous problems, such as appendicitis or pneumonia or meningitis, who need to go out for emergency medical attention. And so that's what I've done for the last 14 years.
Doctor, what are some of the skills that you train local individuals in? For example, I'm thinking of the 60 respirations per minute of a child to teach the field worker that might be pneumonia, don't throw hot wax, but maybe refer. Can you comment on that, the culture?
Yes, what we're teaching community health to this resource person. We're teaching them to take the vital signs, the pulse, the respiratory rate, blood pressure, temperature. We tell them what the normal range of the respiratory rate is, so when it's dangerous and they need to go to the hospitals because you have a high suspicion of pneumonia or some other respiratory, how to hear asthma versus other respiratory illnesses. We also teach them to be able to take the pulse, just as we do how to take the blood pressure. When is a temperature elevation normal with an illness such as a common cold, which may have what you call a low-grade temperature, or fever, which is not dangerous but should be monitored, versus when does it get to be a dangerous level. All these things is part of their ability to examine a patient and determine what the dangerous signs are.
All right, YouTubers, I'm going to put a little shout out to Dr. Sam here. People don't have medicines. You've written a book on how to use herbs to reduce like blood pressure, what plants. Correct. Is that correct?
Correct. We have about 30 pages. Now this is based upon primary Asia plants, primarily because I'm in the southern Philippines. Most of them are related to that. These are medicines that have at least 3 references in the literature that makes them safe, and they're also all approved by the government of the Philippines to be used for home remedies. So we've made sure to do our homework before putting them in our book. But for instance, I'll give an example of one, a very common one. Lots of people have a little bit of swelling in their lower extremities, especially after working all day. Particularly in pregnancy, the normal part of particularly the last trimester or the last 1/3 of pregnancy has to do when they have a little bit of swelling. Now I'm not talking about toxemia or some really dangerous state, but I'm talking about normal pregnancy. So what do you do with that? Well, if you're far from doctors and you have these kinds of problems, you can take the silk of corn, which in the Philippines they call the hair of corn, and you can make a tea out of that. And you can drink that, and it's a natural diuretic. Proven to be safe for 3,000 years, even far back in China as well as in other countries. That's been used safely and has even been tried in modern times. And so this is a natural remedy for whether you're pregnant or not pregnant, to get rid of extra fluid that is a common part of aging as well as in pregnancy.
And then, Dr. Sam, can you tell us, now we're going to do some free ranging here, did you help out on the worst typhoon ever in recorded history? That's Typhoon Yolanda?
Yes.
Tell us a little bit about what you did and what you saw. And by the way, folks who are watching this, if you like that, we're going to look down below, and there will be a link to Dr. Sam. You're on Facebook, and I think you have a website, and you can read more and watch the videos. Tell us a little bit about your experience with that tragedy.
That was a tragedy that hit the Philippines in the year October of 2013, running into the recovery was into 2014. This was one of the things that made it so dangerous was the very fact that not only was it the largest one, and we're talking about largest as in the radius or the diameter was over 100 miles wide, but it was also dangerous in that it had if you will, a or a tidal wave in front of it that hit the coast as the high winds came in, and the wave itself was particularly dangerous, and there was over 10,000 deaths from this, and that's a very high number of deaths. And that was because although they sent out a small warning, they did not send any troops in to evacuate the coast in preparation for this large hurricane beforehand. And so there was a lot of damage all along the coast as well as on the land from that. We went and spent 3 months there. We had teams coming in from Germany. We had teams from Australia. We had teams from China, from Korea, from Thailand, Vietnam, from U.S., Canada. And as being a person who already is in the Philippines, having a Philippine team, all who could speak English well and all who could be team leaders, we would go and we'd bring the team in. I'd assign one of my nurses to the team, and we'd set up where they were going to be at. We'd take one of my other nurses and we'd assign them to a different area. And so we'd have a number of teams at a time. During those 3 to 4 months that we did the follow-up of that natural disaster, we saw some 9,000 patients.
Thank you, Doctor. Now, in your experience there and working Yolanda and also working out into the community, the culture, is there some animism? Are there things going on there that if I were to come to volunteer and to help out that I might want to know a little bit about? For example, death and dying of abandoned homes. When I visit, I've seen abandoned homes. Can you tell me a little bit about how that's treated?
As in the United States, if places are abandoned, then there is a tendency for someone to stay there because they have a lot more rights for people who don't own land, who actually come and live on land for a period of time.
Squatters' rights.
They're called squatter rights. Now, in the U.S., we don't really have squatter rights because if they're not on your property, then you can have them removed. In the Philippines, that's not near as easily done. And partly because they have so many tribes and the land has been taken away and then people still live on the land, so that they're accustomed to people living on the land. And also they will then have families who come and watch over property, and then they live there a long period of time, and that gives them some rights to be there on the land as well. So that's a real big issue in the Philippines, is how do you determine? Because you cannot actually clear property unless the squatters who are on the property is settled. Now, if I was going to buy a piece of land, or in the Philippines, let's say I'm Filipino, to do that, then that would be the owner would have to settle with the squatters and have them cleared off the land before the land could be sold to a new owner. So this is, and they would have to have some kind of settlement to solve that issue. So it's actually quite a legal process. And one reason why some pieces of property is never settled, because they have not been able to settle the property of the squatters who are on it.
And do the squatters often come on property, for example, that's been abandoned due to a construction accident or a death? Or I've seen partially built buildings in the Philippines, in Cebu, Davao City, where there's just stopped construction, nobody there, and it looks like it's abandoned. And people have told me somebody's died in that building.
There is a lot of superstition surrounding death. And if there's been a death and someone died during the construction, then they will be afraid of it. The worker, they will have a hard time even hiring anybody to come in and work. They just will not do it. If there was a need for a person who had died to be traveling, even an infant or something, to be taken from one part of the country to another, if it's known to be on a bus, then no one else will ride the bus with that body. And so there's a real superstitious fear of death and the dead in the Philippines. And it's a little hard for us in a Western culture to attribute to that. But if there's been a death, a certain kind of death in a house, that house may not even be able to be sold. There will be no one who will buy the house.
And Doctor, what about in terms of people understanding, for example, if I have an illness and I have to take medicine for 30 days and the illness starts to recede, I start to be cured, but the prescription says you must take for 30 days. And is there a struggle with people getting them because of the cost of medicine to continue the regimen because they see the results and they see health and they don't realize that, you must process on? Have you come across that? And can you add a little bit there?
There's actually two sides of that. One is that if a person goes to a physician and he writes for 5 medicines and they're in the clientele of patients that I see who we're talking the very poor, then they will go to the pharmacist and they will ask the pharmacist how much each of the medicine will cost. And they may say, oh, well, that's very expensive. I can only afford 1 tablet of that. And then they will go to the next list. Oh, I can take that for 1 day. And then when they run out of money, regardless of how many tablets they've already bought, then that's it. And of course, once they take those medicines, they do not go back for any more. And that's a very common practice in the Philippines. The other problem is there's a belief that no matter what illness you have, you take a pill and you'll be okay. You got cancer. Oh, where's the pill I can take so this will go away, so I'll be cured? Or, no matter what the illness is, there's kind of that kind of belief in the fact that for every problem there's a pill to take to make it well. And that's also very difficult. The other is that they think that they're cured. So you take your blood pressure for 2 weeks, somebody takes your blood pressure, now your blood pressure is normal, so they're cured and they will stop their medicine. So they don't need to take medicine anymore. They are concept of the fact that you have to stay on certain kinds of medicine for a long period of time because that's what keeps your blood pressure normal. That concept is very difficult for them to understand.
Do you hold seminars and ongoing treatment or lectures in the barangay, out in the boondocks in the province?
Yes,
to
we
continue? Do. And so visible presence and simple, that information can be passed on to individuals that don't have a high school education. People can help. Are there needs that can be met if people present who are caring and reasonably intelligent?
Yes, and we do a lot of time explaining the reason why. For instance, why do you need to go on clear liquids when a person has diarrhea, for instance? Because the bowel is overstimulated, it's moving very fast, and that's why that the stools are so watery. So if you slow that down, there's time for them to form and for that to resolve. And to do that, you have to not stimulate the tract with food or other things that would be stimulating, such as caffeine. So you have to avoid those things that would stimulate the tract. That's very difficult even here sometimes for people to understand, but there it's very difficult because they don't have the same understanding of infection. They don't have the understanding about food and stimulants. And of course, rice is not just food. It's the essential. You get it morning, noon, and night, and therefore, if you say no food, they'll think rice is not part of that statement because rice is an essential of life. So you have to very specifically say no rice as well as no solid food, and only clear liquids mean you can see through it. So you have to be very, very specialized in your statements for them to understand what you're trying to direct them to do.
Let's unbundle that a little bit. What I heard you say is that when you have a loose stool or a runny stool, less food is what's going to help it, less solid food.
In fact, you're supposed to go 24 hours on clear liquids. That means no solid food. And you only progress your diet if your watery stools have resolved. In other words, if you haven't had any watery stool in the last 12 hours, you can advance that to full liquids. But if you're still having watery stools, you have to stay on clear liquids until it slows down. So you don't advance unless things have made a positive progression. And that's a very hard concept to teach people who've never heard it before. Most of the viewers in the U.S. who've had community health or who've been treated by mom and dad know and understand that. That's the thing in the Philippines. Many of the things that you know at home, that you've taught, that your family's taught you, you never went to a class, but you know about these things. You know to wash your hands before you eat. You know all these simple things to prevent disease. But in the Philippines, many of those concepts have never been taught, so they don't understand how to prevent illness.
Do they also worry about no food because it might cause an ulcer?
Yes, that's one of the problems in why they will not avoid food, is because to them, if they miss one meal, they'll have an ulcer. So, they're very, very particular about eating their meals. You don't want to work through lunchtime. You don't want to work through supper time. You don't want to miss breakfast. Every meal is very important in the Philippine culture for that reason, and therefore, a doctor telling them to stop eating for a long period of time is just very anti-cultural in context. And that's why you got to remember, though, it's not the watery stools that causes death. It's the dehydration that results from the water loss. And that is very crucial in small kids because they get dehydrated so much faster, and that's why there's so much death in children, particularly if they're kept out of this cultural thing. They'll keep feeding them solid foods, particularly rice, and that keeps them then having watery stools, which means the dehydration presents, and without proper treatment, they will die. And so that's why it's a big health risk, and the cultural ramifications of food is important.
Can we come back and we're going to do probably maybe a 3-minute segment on children and dehydration prevention methods. Let's bring that back in another follow-up. Is that okay?
Fine.
And now I'm moving here, kind of free-rolling. This is about a half hour, folks, YouTubers. Just to introduce you to Dr. Sam. How do you sleep when you go out there in the provinces? And I've been with you. I want you to tell your story and about the fans. And in the context, for all fairness, you're aging, you're a boomer, and you're aging and aging. You've made some choices. I want to get into that a little bit, but right now we're free-rolling. How do you sleep out there?
Well, I make partnerships with communities. And in the community, they provide me with food, which is Filipino food, whatever they have in their community. They provide me with lodging, and that has to be defined further. And they provide with safety, and they provide people who can speak dialects. You got to remember the 300 dialects. And they also provide whatever equipment we might have, such as tables and chairs for the site that we're going to be at. And they also are responsible for picking the students. We don't pick the students. The host will do that. Now, where are they at? We're talking about places. When you go off the highway, you go to the end of the road, and then from the end of the road, you take the path to the mountains. And that's where we go. So we go to very remote places. So when I talk about sleeping, we're talking about maybe if they've got a concrete floor, we sleep on the floor. Maybe if they have a table, we'll sleep on the table. Maybe if there's a nice person in the village who has a home, maybe when we say nice, it may be bamboo, but at least it's dry. We may sleep, there. So it's whatever the host has that they will provide for you to sleep. A few times we've had some very nice places to sleep as well. So there's a big wide range of places to sleep. And that gets to be a little harder as you get older. I will have to say that having a different bed every week for 3 or 4 nights has a tendency to disrupt your sleep somewhat.
I've seen you when you're sleeping, and you sleep with a fan. Fan because mosquitoes come out at night. Tell me a little bit about that and tie it into dengue fever.
If you think about mosquitoes, they're like helicopters, and helicopters do not do good in wind, and neither do mosquitoes. Mosquitoes hover and they want to come down. So when the wind's blowing, they'll land somewhere and stay out of sight until the wind stops. So having a fan on really makes a big difference. Now, dengue fever is one of the fears. It's a great fear in the Philippines. It's kind of like people here might fear pneumonia or something, because dengue fever can cause death. There's 4 different dengue fevers in the world, and you only get each one once, because think of dengue fever like it's a virus. Think of it like influenza. If you've had a particular type of influenza, you actually never have that type again. You can only have a new mutation. Unfortunately, influenza mutates every year. Well, dengue is mutated 4 times in the world. So if you've ever had each of those 4 strands, you would never get dengue again. Unfortunately, each time you get dengue, however, you tend to have a bigger drop in your platelets, and that's called hemorrhagic dengue, and that can cause death. So each of the 4 times you get it, it becomes a more serious illness, in other words. Now, dengue mosquito is a social mosquito. It only flies out at certain times of the day. And specifically, it flies out 2 hours before dusk, and it will continue flying out until about 2 hours in the mornings. And so the dengue fever is actually only out 2 hours from just before dark, and then after daylight for 2 hours. So as long as you don't sleep late in the bed, which is when most people actually end up getting bit by dengue, it's usually not because people are moving around so much. And so as long as you know those times, you can be careful to avoid the dengue mosquito. It also is social in that it lives in cities. It's not actually in the mountains where I'm at that you usually get dengue. It's actually in the cities and overcrowded places, because it likes to live and it is thought that it probably doesn't travel more than 100 yards from where it was hatched in its life. So it doesn't actually travel that much.
Pools of stagnant water.
It likes pools of stagnant water. Like as he was saying, such as inner tubes or tars that's been laying out, or cans that's been left open, or the top of a bamboo that's sticking up for a post, or any place where water might stand for a small period of time. That's where the dengue would probably hatch at.
For those folks here who are, we're discussing your aging and the aging of a medical doctor in the world, in the Philippines. I've seen families go to the hospital where they suspect dengue in a child, and you'll have an IV in there and they're waiting. And then the treatment choice would be transfusion of blood. And then I seen alerts go out on Facebook to say, hey, anybody in this area, can you come over and donate some blood? Why that's important is because I want to talk about that. Is that the treatment choice? And have you observed that? The second thing is it seemed like the equipment they used was very simple when they separated the platelets. It was just a centrifugal moving these test tubes around. And if my blood didn't match, they'd still take it, but they would use somebody else's blood because people can't afford to buy the blood. That's one. A comment on that.
The treatment, if your platelets get so low, would be to give platelets. Now, you could get platelets in whole blood because if you give whole blood, there is platelets in that. But normally, like he said, they will separate the platelets out and just give the platelets separately. There's some problems with that in that you have to have the right blood type. The blood type in Asia is most common type there is actually A positive, rather in the U.S. it's O positive, so it's not quite the same as it is here in the U.S. But there is a problem because, for one thing, there are not that many people that donate blood, and especially in the villages and remote places, they don't have blood at all. So there's a much more limitation on blood and receiving blood in the Philippines than there is in the United States for that reason. The cost also, they have to pay quite a bit. And what they will do, though, to try to balance that is if you go to donate blood in the name of someone, then that person can receive, for every 2 or 3 people that donate blood, they can receive a unit free. And so that's one of the things you can do is donate blood, and it stocks up for a person to receive blood free because the bank ends up with more blood than they started with.
All right, thanks, Doctor. Now, on the some of the we were talking earlier today about totem poles and protection. What's a little bit of the culture that is the shamanism, the totem poles, the white ladies, the black ladies. Can you just kind of...
As that relates to the Philippines, it's interesting because the Philippines was under the Spanish control and was their part of their empire for 330 years. And that came about, though, through the Central America. So the Spaniards went to Mexico and Central America, and then they sent people to the Philippines from there. So all the Central America witch doctors, voodoo, and all the things that they had there was carried to the Philippines, as well as the Catholic Church. So it's the only Asian country that actually it has a Catholic background. And the superstition, however, met with people who've already believed in the spirit of trees, the spirit of woods, and so forth. And so now they build altars for, they'll sacrifice their chickens, they'll bleed the chickens on the altar. Of course, they'll eat the chickens afterwards, but that's to appease the evil spirits so there's no bad vibrations, there's no one out there to harm them. They'll do the same thing with their totem poles. They'll have totem poles, and they have a strong belief in their ancestors, and they'll pray for their ancestors to watch over them and to guide them and to protect them. If they have a child that's deformed, they may take the child out, because if the child's deformed and it's born, they'll say, oh, that was an evil spirit, there's bad influence in the family, or the parents or somebody who's done something bad or evil. And culturally, historically, they would take that child and leave it in the woods overnight, which means the child would die.
That's the karma? Is that, or something different?
That was a karma to balance this evil spirit, and therefore to make peace so that it wouldn't happen again with their next child, so that it wouldn't haunt the family, because they always felt like that those kinds of things was a result of an evil influence that you had to appease. Yes. And
related there too, so white ladies are ghosts, black ladies are witches.
Yes, they actually have the white. And they have a one-eyed cyclops as well. So you have all these different things spiritually no one actually has ever taken a picture of or been able to document, yet it's a belief into the culture that you have this, and that the white one is out to watch over you and protect you, and then the black one comes and is going to suck your soul and take it to bad places and do bad things.
And how I came across this is that when you're trying to deal with an infant that's sick, sometimes they will present the child with these little red dots on it, real little red, where they put hot wax on it, really not to hurt the child, but to pull out that bad spirit, because the child's got pneumonia. And the treatment, or when you're teaching, you're not always able to stay there, So you'll go into the village and you'll pick somebody that you trust and indicate you need maybe some medicine and a doctor or a nurse when you have 60 rapid respiration. I think it's 60, is it?
Yes.
Okay, that's a sign of pneumonia.
Yes.
And it's a preventable death.
Yes.
And they can do the wax. You don't have to stop the wax, but you want to put the positive there. You don't have to spend time saying the wax, because the wax isn't going to kill, but you'll see all these little red spots on it. You want to save a life, so you talk about that.
Yes. And similar to that, they'll also bleed a person with the same concept. Is they'll bleed a person, they'll open a wound and let the blood drop out, trying to get rid of the evil spirits. So, but all of that is a matter, it's all related to superstition about good and evil, and the fact that sickness and bad things happen because you somehow encountered an evil spirit, or you're on the bad side of evil spirits, and so they're always trying to appease or make them happy so that their health is returned, and that, you know, good things will happen in return. So.
And the good news is you can survive in that and build new pathways that are positive. You don't have to attack the superstition.
No.
You don't have to comment on them. You can live with them. And people coming from America, you can still be a positive influence.
Yes. And what you can do is try to tell them that they have hope, because we know one who has power over all those spirits. And so therefore we have one who will be able to protect them and also provide them a better health for that reason. And that's through, of course, Jesus Christ.
And then aging there. And you're aging, and you're motivated, you're faith-based, but you work with all kinds of...
Yes. We work with Muslims. We work with just people who believe in just spirits. We call that spiritualism. We work with a lot of both Protestant and Catholic. We work with even there's a lot of groups that actually are even off far out. You would call them
on the margins.
Yes,
the
on
bad
the marginal groups. Yes, and you in that culturally, there's a lot of different groups also in prestige. For instance, the Bajau, which are seed gypsies. They don't have land of their own, and they are the kind of they walk the streets and sell things, or they're beggars on the street trying to get money for various activities, and they'll beg. And so I'll need to stop at this time.
You need to take that? All right. Thank you. We'll be back, YouTubers, on another tape.